Good afternoon to all. I'm Kalini, lecturer at SNS College of Allied Health Sciences, Department of Physician Assistant. So today we are going to discuss about rheumatic heart disease. So let's get into the video. The introduction for the rheumatic heart disease is rheumatic is an inflammatory autoimmune disease that occurs following Streptococcus pyogenes infection such as Streptococcus pharyngitis. That may affect connective tissues of the body, especially those of the heart, joints, brain, skin, and it is called an strep throat infection. Okay, so next, the definition for the rheumatic heart disease. Rheumatic heart disease is a chronic condition resulting from rheumatic fever which involves all the layers of the heart, that is pericarditis. Okay, so what is meant by pericarditis? Infection and inflammations of the pericardium layer is called pericarditis. Okay, and it is characterized by scarring and deformity of the heart walls. So this is the definition for the RHD. Okay, next, causes. The main causes for the RHD is group A Streptococcus infection. Okay, then coming to the risk factors. First one is family history and environmental surroundings, and then the last one is type of strep bacteria. So these are all the risk factors for the RHD. Okay. So next, coming to the pathophysiology for the RHD is first group A Streptococcus, hemolytic Streptococcus cause pharynx. So when the bacteria is entered into the pharynx, it causes infection and inflammations of the pharynx. So infection and inflammation of the pharynx is called pharyngitis. Okay, it causes pharyngitis. Next, the infection may proliferation exudative inflammatory process. Then antigen bind to receptors of the heart. Then it is divided into three groups of infections. One is pericarditis, second one is myocarditis, and the last final stage is endocarditis. Under the pericarditis, fibrous exudate, serous fibrous exudate is present. Then next to that there is a thickening of heart muscles or heart layers present. Okay, then fibrous adhesion layer is thickened. Last one is pericardial friction sub. Okay, under the myocarditis is infection and inflammations of the myocardium muscle is called myocarditis. Under the myocarditis, fibrotic changes are present in the myocardium layer and vegetation of walled leaflets. That vegetation of walled leaflets may changes into fibrotic changes and scarring and shortening of walls. Then the walls loses elasticity, and the last one is stenosis regulations. So after the stenosis regulation, there is improper blood flow to the heart. Okay, so next, endocarditis. Endocarditis, what is meant by endocarditis? Same like that, the infection and inflammation of the endocardium layer is called endocarditis. So under that endocarditis, there is a swelling, erosion of the walled leaflets. It is a final stage of rheumatic heart disease. Okay, so next, move into the bloodstream, and the swelling and erosion is moving into the bloodstream, and embolism thrombus formation is there present. Okay, so next, if it is moved to cerebral circulation, stroke occurs. So stroke varadhukana chances vandu jaasti irukum. So these is the pathophysiology for the RHD. Then clinical manifestations for the rheumatic heart disease. First, there is two types groups of clinical manifestation is there. One is minor criteria and another one is major criteria. So under that minor criteria, fevers are present, pain, heart murmur, there is a abnormal heart sounds present, then fatigue, chest pain. In ECG, there is a prolonged PR intervals present. Okay, next major criteria. Major criteria la mono and polyarthritis